Welcome to PCOM Perspectives, where we discuss news, events, research, and other topics impacting our campuses and communities. Join us as we share our PCOM perspectives. Hello, and thank you for joining us. I'm your host, Dr. J. Feldstein, and today we're talking with Dr. Paul Offit, Director of the Vaccine Education Center and an attending physician in the Division of Infectious Diseases at Children's Hospital of Philadelphia. Dr. Offit is an internationally recognized expert in the fields of virology and immunology and was a member of the Advisory Committee on Immunization Practices for the Centers for Disease Control and Prevention. He is a member of the Food and Drug Administration Vaccines and Related Biological Products Advisory Committee and a founding advisory board member of the Autism Science Foundation and the Foundation for Vaccine Research. Dr. Offit has published more than 160 papers in medical and scientific journals in the areas of rotavirus-specific immune responses and vaccine safety, and even co-invented a rotavirus vaccine that was recommended for universal use in infants by the CDC. Today we'll discuss how misinformation is dismantling public trust in government health agencies and the importance of vaccine safety in light of new legislative guidelines. Welcome, Dr. Offit.
Great. Happy to be here.
Okay. So I got a couple questions for you. And the first one is, we talk a lot about childhood vaccines as if only children are affected. But those on immunosuppressants, including cancer patients, are also at risk of catching these diseases and having potentially life-threatening consequences. What risks are we ignoring if childhood vaccination rates decline?
Well, childhood vaccine rates are declining. We've seen that over the past year. We had more cases of measles during 2025 than we'd had in more than 30 years. Number 3 equals the total number of measles deaths in the United States over the last 25 years. The children who died, that represents the first child death since 2003. That's more than 20 years ago. We had more cases of tetanus last year than we'd had in 10 years. We've had children dying of whooping cough, dying in states that hadn't seen whooping cough deaths in years. And we had about 290 children die last year of influenza. We hadn't seen a number that big since the influenza pandemic in 2009. So rates are declining, and of course it affects everybody. I mean, I think the sort of the mantra of the day is medical freedom, individual freedom. And that really is in direct contrast with public health, because there are people who can't be vaccinated, who depend on those around them to protect them. There are millions of people who have cancer chemotherapies or immune suppressive therapy for their autoimmune diseases that depend on those around them to protect them. So of course it affects people, all people, including adults.
So it feels like we've really lost our sense of public health in this country, and that individual rights are now outweighing the common good. I mean, do you agree with that? And what can we do about it?
I agree with that completely. I think, if you step on a nail, a rusty nail, and go to your doctor's office and your doctor offers you a tetanus vaccine and you choose not to, no one's going to get tetanus from you. It's not a contagious disease, but measles is the most contagious human infection. The question you ask, what can we do about it, is the question of the day. I don't know. I mean, I think you're dealing with a couple forces that are huge. First is that vaccines are largely a victim of their own success. We don't see these diseases today. My children didn't grow up with these diseases. We eliminated measles 25 years ago from this country in the year 2000. And people, I think at the same time, we've eliminated the memory of measles. People aren't scared of measles because they don't remember measles. So I think that's number one, is that people are much less compelled by the diseases. And then secondly, it's much more readily available that you can find scary, incorrect information about vaccines. So those two things, not fearing the disease and then coming more to fear vaccine safety issues, is what's at work.
It's funny. I had written an editorial a couple of months ago for the Inquirer. I had the measles. I remember what it was like. It wasn't fun. I mean, I was really sick, and people discount it. I mean, it was the worst to this day. It was the worst headache of my life. I mean, the photophobia was unbelievable. And people think it's this benign condition, and it's not. And, my plea, and when I talk to medical students, is you've got to really reinforce that these are not benign diseases. and that people really need to get vaccinated. And I think we need to do a better job of, dealing with this vaccine hesitancy. How do we teach our medical students and residents and even physicians in practice to deal with this misinformation? And what can we do to reassure parents that it's really the right decision and choice to have their children vaccinated?
Well, I do think it comes down to the parent interaction with the physician. I think that's where the rubber meets the road. And I do think we have to realize as physicians that people are scared of these vaccines, and you have to take that seriously. You can't just set aside the fact that they shouldn't be scared. There's no reason to be scared. I think you have to embrace the fact that they are scared, and that we need to try and do everything we can to sort of reassure them, to talk them down. But one thing you don't do is tell them that their fears are ridiculous, because it's so prevalent, the misinformation, that you have to realize that it's had an impact and do the best we can. I do think that what will change this is what I fear I got from an interaction with Maurice Hilleman. So Maurice Hilleman was, I think in many ways, the father of modern vaccines. He did the either primary research or development on 9 of the 14 vaccines that we currently give to infants and young children, including the measles vaccine, the last best measles vaccine, which was 1968, the so-called Moreton strain vaccine. That was his vaccine. He created that vaccine. So he was actually dying of disseminated pancreatic cancer in 2004 when I talked to him, although he'd been a friend for 20 years, but he was given 6 months to live and lived about 6 months. But in those last 6 months of his life, I asked him what he thought about what was going on with measles, because we'd eliminated measles by 2000, but because of papers like Andrew Wakefield's false claim that the measles, mumps, rubella vaccine caused autism, you were starting to see measles come back. So I remember sitting in his office and asking him that question: what's it going to take? What's it going to take to convince people that measles is bad, that the measles vaccine works and is important to get? Can we educate people about that? Or does the disease have to come back? Is the only way that we're really going to educate people is that the virus is going to be doing the educating? And he spent a long time before he answered that question. He was looking out at sort of this snowy Philadelphia landscape in suburban Philadelphia, and stared out at that landscape. And then he looked back at me and he said, no, but like with a tear in his eye, I think the disease is going to have to come back in order for people to fear it. And I hope he's wrong, but I fear he's right.
Unfortunately, I share in your fear. And, when you have major health institutions like the CDC and the AMA contradicting each other publicly, how do you advise the overwhelmed parent or patient? Like, who are they supposed to believe?
All right. So in February of 2025, Robert F. Kennedy Jr. was sworn in as Secretary of Health and Human Services. He had for 20 years been an anti-vaccine activist, science denialist, and conspiracy theorist. He had been paid upwards of $500,000 a year since 2016 by something called Children's Health Defense, who were anti-vaccine folks who paid him to represent them. And that's what he did. He would sue pharmaceutical companies. That's how he made his money. And he was paid $500,000 a year by an anti-vaccine group. That's who is currently the Secretary of Health and Human Services. So he has fired all 17 members of the Advisory Committee for Immunization Practices. He has basically eliminated all the major division chiefs at the CDC. Hundreds of people have left the CDC. And so we don't have an Advisory Committee for Immunization Practices anymore. We don't have a CDC anymore. We don't. We have basically an extension of Children's Health Defense, an anti-vaccine group. Now, the good news is that there are groups that are standing up. So regarding, say, the childhood vaccine immunization schedule, you have the American Academy of Pediatrics, which has its own group of experts, the so-called Committee of Infectious Diseases, or Red Book Committee, which have put out their own their own recommendations. And so that's where you turn. And I think that's where pediatricians are turning. I think that for the most part, pediatricians are ignoring the ACIP, they're ignoring the CDC, and they're looking to the American Academy of Pediatrics. Also, states and state coalitions have sort of formed their own expert advisory groups. So we'll see. There's also a lawsuit that is pending. The law firm is in Chicago. The site for this lawsuit is in Boston. But I think that we're going to find something in that. The lawsuit is against Kennedy. It's against HHS for basically misrepresenting vaccines and putting out a bogus schedule. There's going to be a decision, I think, tomorrow. So today is February 12th, tomorrow is February 13th. We'll see what happens in Boston, but pay attention to what happens in Boston.
So on a brighter note, what areas of vaccine research that are in clinical development give you optimism for the future?
Well, I mean, I think adjuvants is an interesting new field. Adjuvants enhance the immune response, enables you to make vaccines that would be very difficult in terms of inducing immunity to be able to induce immunity. I know you want me to be optimistic, but I think that what happened just in the last couple of days at the FDA makes me less
I
optimistic.
know with Moderna.
So you had Moderna submitting their application for their mRNA influenza vaccine.
Right.
They did everything the FDA had asked them to do, and the FDA had agreed that should they meet those criteria, the so-called non-inferiority criteria for their vaccine, that their application would be reviewed. There's no guarantee of licensure, but their application would be reviewed. Their data looked good. Looked like there was enhanced protection against influenza-like illness, enhanced protection against hospitalization, and even for those over 65, when comparing it to high-dose influenza vaccines, that there was better immune responses. This looks like a great vaccine. Nonetheless, Vinay Prasad, who's head of the Centers for Biological Evaluation and Research at the FDA, said no, he wasn't going to review it, even though people who worked for him, people who would have done the review, said that he should review it. So it was one person's decision. And I think that was a chilling thing to do for the pharmaceutical companies that make vaccines, because they look to the FDA for guidance. And if the FDA says one thing one minute and something else the next, then they don't know what to do. And I think that is a chilling effect on novel vaccine research.
Do you think they'll pick it up in Europe in any way, shape, or form? Do you think Europe or China will fill a void here that we seem to be creating?
Yes, if you ask somebody like Stanley Plotkin, who is the senior editor of the book Plotkin's Vaccines, which is a 1,600-page, 20,000 reference book, the definitive text on vaccines, he'll say exactly what you just said. When asked the question, where do you think this research is going to be going on in the future, he'll say China and to a lesser extent India.
Is there anything you like to touch on that I haven't hit on that you think is significant for our audience, which is a lot of medical students, residents, and physicians?
I do think good science wins out in the end. I mean, the fact of the matter is that over the next few years, Robert F. Kennedy Jr. will continue his war against vaccines. He'll continue to blame vaccines for autism and diabetes and multiple sclerosis. He'll look at aluminum-containing adjuvants in vaccines. He'll do what he does. And he no doubt will be able to get some discredited scientists, some discredited physicians, media venues, congressmen to stand up for what he says. But he'll be wrong. And that matters. I think science is a powerful thing to have on your side, and we should make sure that we continue to stand up for it. It's Galileo, right? I mean, Galileo in the 1600s had written a treatise buying into Nicholas Copernicus's notion that the earth revolved around the sun. Well, that went against the Roman Catholic Church's teaching at the time that the earth was the center of the firmament. So he was brought up before a tribunal and forced to recant what he said, that the earth revolved around the sun. But as he was being let out, he said, presumably in Italian, and yet he said, it still moves. Meaning, you can put me in chains. That doesn't change the fact that the earth still revolves around the sun. And nothing RFK Jr. can say or do will change the science of vaccines, which that vaccines are safe and effective, and that we do clearly benefit from them. I just think in the meantime, while he continues to have the position he has, children and adults will suffer.
Well, at the end of the day, medicine is based on science. So that is the hope for the future. And I think it's imperative on physicians that they stay grounded in science, because at the end of the day, that's who patients are going to rely on.
Don't be scared to stand up for the science. Don't be scared to let your voice be heard. I know it's sort of a frightening time. People fear retribution, but just do what's right. Doing what's right isn't always the easy thing, but it's the right thing.
Well, I think on that note is a good note to close on. And I'd like to thank you, Dr. Offit, for joining us today and for continuing to be an advocate for science and vaccine safety, and a reliable and, most of all, a trusted voice for health information. I'm Dr. Jay Feldstein, and this has been PCOM Perspectives.